As I ascend the stage, also just to remind us that I not only representing myself and my jacket, but I also represent the jacket of Our Excellency, the Deputy President of the Republic of South Africa, His Excellency Honorable Paul Mashatile. Let me recognize our host, the Premier in absentia, represented by our sister here, MEC for Health in the province, MEC Nomagugus Melane. His Worship, the Mayor of eThekwini, Mayor Mkolisi Kaunda, our host. All the MECs who are here have already mentioned. We've got the MEC for Western Cape, Mpumalanga, Gauteng, Northwest, Deputy Ministers present, Deputy Minister Bukopani Zulu, and also Deputy Minister Regina Mhauli. All the program directors, of course, otherwise they're going to tell me the time is up. Our two program directors, Dr. Gloria Maimela and Dr. Tato Chitarike. Members of Parliament from the National Assembly and I believe also from the NCOP, members of the legislature who are here, the leadership of SANAC, led here as the co-chair, Ms. Steve, and the civil society forum, the private sector, and I think, yes, I've recognized also our partners and foundation members, ladies and gentlemen, our partners also from the UN family, from UNICEF, UNAIDS, WHO also, Dr. Kalua, the country director, is always with us, our managers, various managers from the DG nationally to also the provincial, and also, of course, the CEO of SADC, Dr. T, Dr. Tembi Tulu, all the esteemed guests, ladies and gentlemen. As I've said, in the interest of time, we have agreed with the DP that we'll give one message to this conference. We are indeed very privileged this evening to speak at this 11th South African HIV and AIDS conference, which is held under the theme, Act, Connect, and End the Epidemic. This gathering is taking place a few days thanks to the members of the National Assembly, those who supported and those who didn't support. We thank all of you for passing the first ever National Health Insurance Bill. Thank you very much. And this morning we will be presenting to the Select Committee for Education and Health in the NCOP. They are already running with the bill. This work of the passing of this bill is a reflection on the progress that we are making as a democratic government in ensuring quality and equitability of access to health care in line with Section 27 of our Constitution. As we will be marking 30 years of freedom in 2024, just in a few months' time, just over 6-7 months' time, we'll be starting our celebration of 30 years of democracy. The introduction of this national health insurance is just an additional path in reflecting on the progress that we are attaining as a country in making sure that there is full equity and equality. While counting on the progress and the improvement of material conditions, we also acknowledge some of the moments and events which have led to some setbacks in our development agenda. And as already reflected by many speakers, the pandemic which we have just come out of, having the WHO declaring an end to COVID as a public health emergency of international concern, it's one of those setbacks which we have suffered in this period. And this has made it impossible for us to have physical AIDS conferences, and the last one before this one here was only in 2019, just before the pandemic struck. In line with the theme of this conference, we acknowledge that indeed it's time to act, connect, and end the pandemic of HIV and AIDS. continuing with the efforts towards the global agenda of 2030, the ambition of ending AIDS and HIV as public health threats. It is also imperative that we keep in mind that by 2025, we have to reach our 95-95-95 target, which is outlined in the Global AIDS Strategy. A new set of ambitious targets calls for 95% of all people living with HIV to know their status, 95% of those who know their status also to be on treatment, on sustained treatment, and resulting in 95% of them also being on viral suppression just in 2 years' time. In fact, in less than 2 years. 2025 means just 1.5 years from now. As a result, ladies and gentlemen, in the remaining 2 years, we have to, maybe correcting ourselves, that actually 1.5 years, just 18 months. We have to accelerate our efforts in order to meet these targets. Though we have made some great strides towards achieving this 3 95s, we still have a long way, especially in the second and third 95s. I think presentations which have come earlier on have shown that we are currently at 94% of people with HIV knowing their status, but when it comes to initiating one treatment and sustaining the treatment, we are still far off at 77%. And in terms of those with viral suppression, 92%, but which is not a true reflection, because it's 92% of 77. So we actually have a long way to go in terms of especially the second and third. We're also lagging behind as a country when it comes to meeting all the set targets in respect of especially males and also with children, in terms of both status, knowing status, and also treatment. More effort is needed to place and retain more people on HIV treatment. In order to achieve the 95-95, we must initiate over 1 million people on treatment if we're going to reach this target. As we said during the launch of the NSP, we need to redouble our efforts and raise awareness about HIV and TB, also in terms of the social determinants and the social implications. We must reinforce our messages, and agreeing with my sister here, the MEC, that we must reinvigorate those messages, make sure they are relevant, and also make sure that we can reach especially the young people on the platforms which they spend their time on. We still need to invest in terms of billboards, TV, adverts, and so on, but let's not leave out the social media, because that's where they spend most of their time in. Our commitment to the task is in accordance with the realization that the goals of in line with the goals of the Global AIDS Strategy. We are ensuring that 95% of people at high risk of acquiring HIV must have access and use of combination preventative measures. Further, we have embedded many of the 10-point plan of the 2025 prevention roadmap in our own national strategic plan. The 2025 roadmap identifies 10 priority actions that countries must take to resolve the remaining gaps and rebuild momentum to end AIDS as a public health threat. This is the 10 points from the UNAIDS. Those 10 points, very quickly, is 1, to conduct an evidence-driven assessment of HIV prevention program needs and barriers, determine the country investment needs, working to ensure sustainable finance on HIV prevention, as already mentioned by my brother here, that we are one of the countries which significant domestic investment compared to many countries, but we still have to do more to reduce our dependence on donors. We must adopt a precision prevention approach, especially for key priority populations, as already said by Comrade Steve and the Civil Society Forum, including differentiated national prevention targets. We must reinforce prevention leadership entities for multi-sectoral collaboration, oversight, and management of prevention responses. We must strengthen and expand community-led HIV prevention services and set up social contracting mechanisms. We must remove social and legal barriers to HIV prevention services. They've already mentioned about the decriminalization as one of those. Promote integration of HIV prevention into essential services to improve outcomes. We have learned a lot also from COVID as it was disruptive, but also that there are times, of course, when there must be vertical programs, but vertical programs can only be important for a limited period. With time, we must make sure, as we now have exited the vertical programs of COVID, integrated into other services, but also as we come back to refocus on the two epidemics of HIV, TB, the three with STIs, we must also integrate into the whole comprehensive services. Set up mechanisms for rapid introduction of new HIV prevention technologies and program innovations. We must establish real-time prevention program monitoring systems with regular reporting. If you don't have the information, how do you going to monitor your progress? So the issue of reliable, credible data on our programs is very important. Lastly, strengthen accountability of all stakeholders for progress in HIV prevention. In our case, government, civil society, private, business, labor, we must all be held accountable in terms of have our clear roles and also be accountable. Building on this, let us continue to work together to successfully implement the prevention roadmap and guide our HIV investments and collectively reduce new HIV infections by more than 80% by the year 2025. You have already seen from Prof. Mlisana here the way in which we are still far off, especially in terms of reducing new infections, because even as we say U equals to U, that's in terms of already in areas where we're not able to prevent. It's fine, U is equal to U, but at the same time we must work much harder in terms of prevention. The HIV-TB prevention and treatment program, as we have indicated, was severely compromised during the pandemic, but we are recovering. It challenged plans and compelled us to enhance new methods, some of which have also given us some new advantages, especially in the area of technology. We have now started to look more into technology in providing our services. Though there are numerous plans designed to mitigate the effects of COVID through those methods, we also used some of those methods we used during the COVID to continue to investigate innovative approaches in terms of provision of healthcare, including reinforcing now prevention and treatment in as far as HIV, AIDS, and TB is concerned, transforming our nation's healthcare system to accommodate the fourth industrial revolution. Moreover, to compensate for the disruption created by COVID, as government, we have also implemented the catch-up plans, both for HIV and TB, allowing for acceleration and integration. The implementation of the catch-up plans has helped us to move a step further towards meeting the 95-95 targets. We are further comforted by the fact that this conference is taking place at an opportune time following the launch of the SNP, which focuses on HIV, TB, and also STIs for the period of 2023 to 2028, which take us further, very, very close to the 2030 targets. This strategy places people and communities at the center of our efforts to overcome inequities in the response to HIV, TB, and also, as we have said, this strategy, we call it the People's NSP. This 5-year plan provides a strategic framework for a multi-sectoral approach that is people-centered to eliminate all three, TB, STIs, and also HIV as public threats. This NSP emphasizes the need to break down barriers and also to maximize equitable and equal access to services through the resilient and integrated health systems which will guarantee the health and social protection of all South Africans. We believe that this NSP should be a game changer if properly implemented. It was created as a result of a pandemic readiness, and it delves very deep into social and structural drivers of this epidemic. The inclusion of mental health services and social support in our NSP is based on a strong association between HIV, TB, STIs, and also gender-based violence. And we've had a very brilliant presentation here by Ms. Ndlovu, which I'm sure speaks for itself in terms of the impact, the correlationship between HIV/AIDS and gender-based violence. The plan also features an expanded scope for the management of sexually transmitted infections, including viral hepatitis, which has been identified to have a very strong link also with the HIV. As we forge ahead with the implementation of the NSP, we cannot overemphasize the importance of continued multi-sectoral and collaboration in this implementation of this plan. We believe that we can do more by leveraging our combination of strengths and resources. The active role of you have seen them, a very vibrant civil society, which keeps us on our toes. The private sector, which we just recently joined the SANAC family, which we already see some of the impact in terms of mobilization of resources. Our development partners, research institutions, and I'm sure during the course of this next 4 days, we're going to hear more in terms of the inputs arising from our research institutions, our social justice activists, such as also the people living with HIV. All of these partners are very important if we're going to turn the tide of HIV, TB, and STIs. One of the biggest lessons we learned from COVID-19 is the importance of integrated approach and also relating health services to broader social mobilization and intervention in terms of social determinants of disease. Social behavior change communication, we have already said that this is not just a biomedical issues, but social behavior is very key. So we need to invest in that and with all the partners. Treatment literacy and adequate resourcing are some of the interventions which we need to scale up. We also need to improve on access to treatment and prevention commodities already mentioned, such as PrEP and also pre-exposure and post-exposure prophylaxis, especially for our key populations, especially the sex workers who have spoken very loudly, the LGBTQI population, and also our young people, particularly adolescent girls. We have already seen from the presentation that we're leaving our young girls, and also the MC spoke about just in terms of their own observations here in the province. Now, on that note, ladies and gentlemen, this being the month of June, being a youth month, but also International Pride Month, let us also say a few words in this regard. We would like to stress again that the South African Constitution forbids any form of discrimination on the basis of a person's sex, gender, or sexual orientation, whether on the part of state discrimination or even discrimination by private citizens. Because of our firm belief that the LGBTQIA rights are human rights, our government will continue to defend and advance these rights. As we move towards the 2030 agenda, we need to strengthen self-care interventions and differentiated models of care to ensure that we leave no one behind, especially again emphasizing on key and vulnerable populations. This approach must further promote interventions that are critical to ensure service provision, which also helps with facility decongestion. These interventions include ensuring that patients who are stable are able to access their treatment closer to where they live, including at pickup points nearest to where they stay. We want to encourage the health department to continue working with civil society partners in developing and strengthening the implementation of the Welcome Back campaign to bring back and retain those who were lost to treatment as a result of the pandemic. And also, as we make sure that those who have never initiated on treatment also as a result of the pandemics are also encouraged, are found and brought into treatment. Ladies and gentlemen, as part of the Global Alliance to End AIDS in Children, because we have also seen that we are leaving our children behind also by 2030, we need to close that gap. We are also sharpening the focus on pregnant women and breastfeeding women, children and adolescents in our HIV prevention programs. Another project which is very important, which is underway, we have already touched on that, is a treatment literacy framework, which aims to improve treatment adherence, eliminate stigma, the very stubborn stigma, and prejudice, so that we can encourage health-seeking behavior and increase also treatment uptake and also remaining on sustaining the treatment. It's important that we make sure that people on antiretroviral treatment keep having their also their viral load checked, so that they can continue also to see that they are still on the right track, and so that they can be guaranteed for a long life. Importantly as well, we cannot be, we know that as we have said already, undetectable means untransmissible, so the issue of more people on treatment and retaining that treatment is something which we must not compromise over. Now, if we all pull in the same direction, there is a chance that we can indeed, in the next 1.5 years, it's a tall order, but we can, as already indicated, some districts here in KZN, by the time the pandemic got on to us, a number of districts, as MEC indicated, 4 districts were already on 90/90, some already at least on the first 95, and also some very close to 95 even. I know it's not only KZN, but because we are here, we must speak more of KZN. But in other provinces as well, there are a number of districts, and we're focusing on strengthening them and making sure that more districts out of all our 52 districts can come on board, so that we can reach our targets. We're looking forward to a very fruitful week of very robust discussion with all the research papers, also not only on the academic side, on social side, with also in terms of all our sectors, from the civil society, from the business and labor, and all the contributing towards the robust discussions over the next 4 days. We are very confident that the discussions which will be happening over the next 4 days will contribute very highly, especially from the scientific point of view. We will continue to enrich our interventions and make sure that we can only get better. We can find more and better and quicker solutions. So, indeed, this is the week at which we are committing to act, to connect, and also to end HIV and AIDS as an epidemic. Ladies and gentlemen, it's my pleasure at this stage to declare this 11th South Africa AIDS Conference officially open. Thank you very much.